Thank you all for being here. I'm really glad to be here. I'm Dr. Jan Polson. I am owner of Basin Natural Medicine right here in Klamath Falls. I actually am a doctor of acupuncture and oriental medicine. And that's what the DOAM behind my name actually, which I can't see my slide on the other wall there. So I guess, there we go. So I'm going to talk about acupuncture and Chinese medicine in the 21st century. If I can figure out how to change that slide.
Very left arrow. Oh, I'm sorry, right.
Very right. Ah, there we go. Okay, got it. So yes, most people don't know what credentials behind anybody's names are, especially those of us in the Chinese medicine community, because I know that some of you here I recognize as my patients, and you know what I do. Most of you probably don't know much about acupuncture or Chinese medicine. So the DOM is a doctor of acupuncture and Chinese medicine, and I'm a licensed acupuncturist. So like Laura, I had an undergraduate and then went to 6 years of medical school. My doctoral degree is in integrative medicine. So basically I was trained how to understand how Western medicine practitioners think and why they do the things they do. And then to be able to work in conjunction with them. So even though acupuncture and Chinese medicine is a standalone, entire comprehensive medical care on its own, it works very well in conjunction with Western medicine. I work a lot with Becca and Laura's patients. They refer them to me. I'm a specialist, not a primary care provider. So basically, my degree is in women's health, advanced acupuncture techniques for pain. So I got to study with a lot of real Chinese people from China that learned their techniques, which was fascinating. And I do a lot of work in chronic illness. So even though Western medicine is fabulous at saving lives, and they do it well, and it is their expertise and their stronghold, they really don't have a good handle on how to treat chronic health issues. They treat them with medications that, as you've learned today from Laura and Becca, damage our bodies over the long run. They're fine to get us functional and out of harm's way, and I have no problem with that. But taken long-term for chronic illnesses, they really rob our body of nutrients. So basically, my passions are in autoimmune diseases and infectious disease. And like Laura was talking about, I also have found that at the crux of almost all chronic disease are pathogens. They're either bacteria or viruses, and they're always there, and we can get rid of them. So next slide. We'll talk a little bit first about acupuncture and Chinese medicine, because I'm sure not many of you really know about it. And I'll talk a little bit about what is integrative medicine. We don't really talk about that. It's a new catchword in Western medicine too. And Western medicine doesn't really even at this point have a good stronghold on how to practice integrative medicine. So it's something they're really coming in to their own with. However, there are a lot of hospitals and medical centers across the country that are utilizing integrative medicine very well. Unfortunately, they mostly take place in big cities like San Francisco, New York. Portland has, I think, at least 3 hospitals that are very good now at using integrative medicine. So we really hope that all of us, even in smaller rural towns, can get there one day, but we're on our way. And then I'll mention a little bit about wellness and what is wellness and how do we achieve wellness. And really, we're talking here about medical advocacy and how we can be our own best medical advocates. Truly taking control of our wellness is even more important than understanding or taking control of our disease, because wellness is the underlying landscape in our physical bodies that help us to prevent chronic disease. And certainly we want to have a system of well care rather than a system of sick care. So we know the sick care doesn't work very well unless your life's in danger. So we'll move on just a little bit about acupuncture and Chinese medicine. So acupuncture and Chinese medicine is very old. Basically, we're thinking now the consensus is about 5,000 years old. In the Chinese medicine community, we know that it's even older because basically Chinese medicine predates the written language, which the written language started in about 1677 BC. So prior to that, there was an oral language. And we know now that Chinese medicine had a rich oral language that then was translated into a written language. So it's very, very old. And the interesting thing about Chinese medicine and this very old medicine is that it has always been very dynamic, not unlike Western medicine. Western medicine is very new in the big scheme of things, maybe 250 years old, very young, although very progressive. Chinese medicine basically is very old, but has always been adaptive too. Over the centuries, when doctors have learned new herbs, new techniques, found out that these didn't work as well, so they dropped them and then adapted new techniques to become more effective. So again, Chinese medicine is very dynamic in its change. It's changing quite a bit in the 21st century, and I'll get to that a little bit later on what we know about how acupuncture works, and it's very fascinating and very timely to our time right now. Okay, so Chinese medicine and acupuncture, like I said, is a whole comprehensive medical system in itself. In our experience, it is the other half of Western medicine. Because Western medicine is great at emergencies, Chinese medicine is wonderful at creating wellness. So the two come together very well and need to be used together. Acupuncture is one of the 5 branches of Chinese medicine. So we have acupuncture, which I'll talk about a little bit later, is utilizing pathways of information in the body to actually change hormone and neurotransmitter release. And I'll talk about that a little bit. There's the second branch, which is herbal medicine. So I actually am a master herbalist. I do a lot of herbal medicine in my practice. Chinese herbal medicine is different than Western herbal medicine. Western herbalists use fairly much one herb, a single herb. They might put you on dongui. They might put you on black cohosh. Chinese herbal medicine is different. Chinese herbal medicine is more like a pharmaceutical without the side effects. So Chinese herbal medicine uses a variety of herbs together to create a synergy that is greater than the sum of each individual part. So you have a medicine. So a lot of times doctors will ask me to tell them what herbal formula I'm giving my patients. And I tell the patient, of course I educate them, your doctor's not going to know a thing about what I'm giving you, even though they might look up these herbs in this formula and know that, ooh, this one, I don't want you taking this one. They don't realize that as we put those herbs together in a harmonious blend, it's creating something different than each individual herb. So Chinese herbal medicine is extremely powerful, very effective, and safe if you have somebody who knows what they're doing giving you the herbs. So that's very important. Kind of like what Laura was talking about. There are people who claim to be herbalists, but they don't really understand how to diagnose the disease and match it with the appropriate herb formula. So with herbs, people ask me all the time, oh, I want to take this herb, that herb. You have to be very careful with taking herbs because they can be counterproductive if they're not the right one for you. The third branch is exercise. In traditional Chinese medicine, Qigong is the standard exercise. It's the precursor of Tai Chi. So when you see those Chinese people in the park, on the movies or whatever, making these beautiful movements very slowly, they are actually practicing a form of vital energy cultivation. They're actually helping their blood flow, they're actually helping their oxygenation, and it's not unlike Tai Chi. And what we know from very specific studies on Qigong and Tai Chi is that they help to bring the body back to homeostasis. And that means they bring the body back to a place of relative balance where the intelligence of the body can start healing itself then. And so when we practice Qigong, basically, we are creating a reservoir of vital energy, and I'll talk a little bit more in just a few minutes about what that vital energy is. We're creating a reservoir so that we can be supported, again, creating a foundation for wellness. The fourth branch of Chinese medicine is nutrition and diet. So someone asked me today at lunch what the difference was between or if I practice nutrition counseling in my practice. And I said, I do. I'm not a licensed nutritionist. However, my schooling does afford me a lot of education in nutrition. Chinese medicine nutrition is a little bit different. We understand more underlying the nutrients come properties of each individual food. So we look at thermal properties of foods as much as the nutrition. For instance, you know that turmeric or ginger are very warming foods. So you can take those for pain, for a cold or the flu, that type of thing. And that radishes and mint are very cooling foods. And so they are truly acting in an energetic way as a medicine in our body when we take them. So for instance, when you have a cold or flu, you might take some fresh ginger to help open the pores so that the immune system can come out and more fully through the blood supply and actually help to fight off that cold or flu faster. Should you have bloating or gassiness, or you just ate some cold ice cream and your gut is feeling bloaty and just kind of stuck there, you'll take some warm ginger. And so thermally, you're balancing the properties. I just had an experience a few months ago with my granddaughter, and I was in Sacramento. It was her birthday. They were ice skating. She turned 6. And they were cold. It was indoor ice skating rink, and the kids were freezing, but they wanted an icy so bad. And so mom gave them an icy, and we're standing there, and suddenly she's shivering. And I said, there you go, Allison. When you're cold, you needed some warm hot chocolate, not an icy. And that's the theory behind that form of nutritional medicine, is that you balance your foods. When you're eating at a Mexican restaurant and they give you, or a Thai restaurant, and they give you cucumber to balance the spicy Thai meal, and that brings back a relative balance in the body. The gut is the hub of all health, as so many people have spoken today to that truth. When we can keep that thermal nature balanced, we would have much less bloating and gassiness, much less acid reflux in some instances. So that's pretty much where Chinese nutritional counseling comes in. And the 5th branch of Chinese medicine is called Tui Na, which we don't really hear much about in this country, mainly because we have a lot of chiropractors and DOs and really good massage therapists and body workers. But in the traditional Chinese world, Tui Na, basically, practitioners were the bone setters. They were the chiropractors. They were the body workers. And so it's a very physical medicine. I do a little bit of that in my practice, but not much. I have some great chiropractors and some great body workers that I refer people out for that type of thing. So those are the 5 branches of this whole comprehensive medicine. And we'll talk a little bit now about acupuncture. So acupuncture has been very misunderstood for many years in this country. However, most people don't realize that for over 40 years now, our own military, the Air Force and the Army, have been doing a lot of research on acupuncture. Basically, it started back in the Nixon era when Nixon went to China and his UPI reporter had an acute appendicitis attack, Charles Reston. And he had to have his appendix out immediately. So he went to a Chinese hospital, underwent acupuncture anesthesia. So he had no anesthesiologist there. He had an acupuncturist there doing anesthesia, had his appendix removed, and wrote back to his paper, I have just seen East meets West. This was remarkable. And wrote his story about how he had no anesthetic. The military then got wind of that, and they started doing acupuncture research. They actually, the first person they asked to do research was Dr. Becker, who is a orthopedic surgeon. That was back in, he was doing research on bone regeneration back in the 60s, and he found that there was an electrical system in the bone. He was doing this regeneration research on salamanders, and how can they grow a new limb? Why can't we grow a new limb? How can they grow a new leg? And he found that there's an electrical system. And so through all his research, which is fascinating, the military knew about him, and so they asked him to do acupuncture research, and he did. What they have found over 40 years is that, number one, we truly do have these pathways of information that run through our body. We have, it's our third electrical system. So we have our central nervous system, which is our first. We have our heart, which is another electrical system. And now we know that we have at least another third electrical system that runs through our connective tissue to our brain. And so these acupuncture points, which Western science is now calling nodes, we see as amplifiers of information. So you have these amplifiers of information that when you put the little filaments, so needles aren't needles. Needles are thread-like. They're very fine. They have no cutting beveled edge. They don't inject or suck fluid out. They don't cut through the skin. They have a very fine point that slides between cells. So virtually, people are very comfortable when they get acupuncture. It doesn't hurt. You might feel a little sensations here or there, but it really doesn't hurt. And so we know that when we put these filaments in the acupuncture points, we're actually stimulating an electrical current through connective tissue that sends a message to the brain and dumps neurochemistry in our brain, changes our neurochemistry. And we know through research that when we change our neurochemistry, we change our biology and our physiology. And so what we found through cutting-edge quantum physics, I've done a lot of research in cutting-edge quantum physics for a book that I'm writing for my field, in my research that I've been doing in my practice. And what we know through this cutting-edge quantum physics is that everything at a subatomic particle level, this is string theory, is a frequency. Everything. So beneath the chemistry, beneath the nutrition, beneath all that we have known so far is information, is a frequency. And so when we put the needle in the acupuncture point, there's a specific frequency that goes to the brain and tells the brain, dump neurochemistry, these specific neurochemistries. We've actually done fMRI studies, brain mapping, that put the needle in the patient, put the patient in the fMRI machine, and watch what happens to the brain. And in every single patient, when we do the same point, the same area of the brain lights up, becomes neuroactive, and changes the neurochemistry. So each different acupoint has a different frequency that it's sending through the body to send information. We all can really appreciate this because we all know that we can talk to Alexa and she can turn our lights on. We can't see that, but we know what happens. We can see the result. Same thing with acupuncture. However, most recently, there's been studies that have actually, through very, very, very sensitive microscopes, have actually now been able to visualize the energetic pathways. And those energetic pathways now we found have photons and DNA within them. DNA is our information. It's who I am. I am my own DNA information. So I have my own frequency. I have my own song that my body plays when it's in tune, as everybody else does. Yeah, it's very cool. And so basically, we know then that we can manipulate or talk to our DNA in that way. And that's what acupuncture does. And so when we put the needle in the body, the brain gets the information, dumps the neurochemistry, the body then puts that information where it needs it, because the body is amazingly intelligent, way more intelligent than we are, way more intelligent than we are. And so basically, we've been doing this brain mapping, like I said, and here's a study that was done this was done through the, what does it say? Center for Biomedical Imaging in Massachusetts, Department of Radiology. This has been done all over the world. I mean, it's not just here. It's Australia first started it many, many years ago, and it's been really catching on. And so we know now it's not some woo-woo thing. We know we are stimulating our electrical pathways through the body. So another study here is on, come on, click. Oh, we don't want to click. Up. Maybe its energetic pathway is clogged. I'm supposed to be able to just click it right there. There we go. There we go. And so we've been talking a lot about cancer today. There's been a lot of research also on acupuncture and cancer. Mainly what they've found is that acupuncture done with a cancer patient who's undergoing chemotherapy or even not undergoing chemotherapy can help with nausea, with vomiting, with xerostomia from radiation. That's a lack of saliva. The glands get damaged through the radiation. Can help with anxiety, can help with depression, can help with fatigue, all because we're not putting a Band-Aid on anything. We're actually telling the body that this is the wrong information. So what happens basically in autoimmune disease, because that's my area of specialty, and pathogens, not with the pathogens, but with the autoimmune disease, even though the pathogens are underlying the autoimmune disease, the body is getting disinformation. So with any kind of chronic illness, the body is getting the wrong information. And what causes that wrong information? The wrong information can be caused by so many things, mainly lifestyle. It's caused by our diet, our stress, an accident, a car accident. Oh wow, time's really gone fast. You had to put that down right now. Yes, I know. So many things can cause disinformation. I call it static information in my practice because I've developed a way through scanning for so we know everything's on a subatomic particle levels of frequency. So I have a device that I use in my practice that scans your body for disresonance. Scans at 15 different amplification levels. So we find out what is bothering your body the most right now with disresonance, and then I eliminate that using a laser that I have. I imprint those frequencies in there, put it on specific acupuncture points, eliminate those frequencies. Your body now can go, ah. Well, it's not unlike acupuncture in what it does anyway, but in my practice, because I treat autoimmune disease, I want the person to get better faster. And so I've developed this way to allow your body to go even deeper into the healing mechanism because I'm relieving a lot of static noise and disinformation from the pathways. And so, okay, I just lost my place. Lost my train of thought on that one because it's so exciting. Totally lost my place on that. Someone give me a question. So I've developed this technique and how we get these static pathways. So we have them through so many means, but we can, like I say, eliminate them to relieve our body and let our body relax and become well. So what happens in my practice is that I practice with the laser and I practice also with digitally imprinted frequency vials. And so I treat Lyme disease and I treat autoimmune disease. I treat them with these vials that have the frequency or the signature, the chemical vibrational signature of these entities, the Borrelia bacteria, H. pylori, Epstein-Barr virus, and I neutralize them basically through a frequency. So we can take herbs and it's great, and we need to. They support our body very well. We can take vitamins and supplements, and we need to because we live in a very stressful world with not a lot of good nutrition. Even in our good food, we know that they're not really full of all the vitality that they used to be filled with. And so what we do then on a vibrational frequency level, remember this is cutting edge quantum physics, we actually can eliminate those frequencies. We know through the science of harmonics that when you over amplify a frequency, you can have a crystal glass and someone can hit that frequency of that crystal glass and that crystal glass shatters. So we know that we can over amplify frequencies and eliminate them. We also know that we can support frequencies through the supportive pathway. And so when I use frequencies that your body needs, say I get from my scan that your body's liver, the particular lobe of the liver isn't functioning like it should, and it gives me the frequency for it, I support that frequency with the laser, and your liver goes, Okay, thank you. You didn't have to take anything. You just simply received the information that your body needed right now to heal with. It's very exciting and it's very cutting edge. It's very interesting because there's new techniques now that they're actually treating a particular form of cancer now with vibrational frequency. So this is truly the frontier of medicine. I really believe that someday, maybe 100 or 200 years from now, hopefully only 100, we'll go into a machine not unlike an MRI machine that will scan our body on a frequency level and do fairly much what I'm doing in my practice on a very small level. But I'm very proud and humbled to say that I feel like I'm a pioneer on this new frontier, and it's very exciting, actually. I've actually had some of my patients who have told me that they really are worried for me, that they think the pharmaceutical companies are going to come and kill me. I said, well, I'm here in Klamath Falls, or they're not going to find me for a while. I'm not making too much noise yet. But it is a very exciting new frontier of medicine, and something that I really enjoy doing, and I enjoy the fact that Laura and Becca were both here because they're amazing, amazing doctors, both of them. They know what they're doing. They're highly skilled, but I'm doing something quite different than they are. And I think you need both of these medicines, as well as Western medicine, because they have great diagnostic, in some cases, great diagnostic machines and tests that give us a lot of information. I love it when people come to me and they say, I've been to 5 different doctors, I've been to OHSU, I've been here and there, I have every single test. They don't know what's wrong with me. And I've had people tell me they think I'm crazy. And I say, good, then I can help you. This is a good thing. I can help you. And so it's very exciting. And it's exciting now that Western medicine does want to start incorporating. However, they still think that sending someone to massage therapy or PT is integrative medicine, especially in our town here, which it truly is not. Yeah. So we need to educate our doctors, and that's the one thing. You need to educate your doctor about what is integrative medicine. So because, on that note with integrative medicine, I have a little video just to let you know what level of integration there is in our country today that I would love to bring here to Klamath Falls. And this is from Johns Hopkins Medical Center. This is their gastroenterology department, and this is an acupuncturist who works at Johns Hopkins treating all kinds of myriad of issues. If that video comes, nope, that's not it. There we go. They promised me it worked. And if it doesn't, that's okay, but it's just a really good video. I wanted you guys to be informed when you go to your doctors that there are many, many medical centers and clinics around the country that are incorporating Chinese medicine and acupuncture because they understand the research and know how valuable it is. Not going to work? Okay, not going to work. Anyway, I'll just do a little synopsis of what this gal said. So not unlike myself, she treats a myriad of issues in her gastroenterology practice. People come to me for gastroenterology also, and I end up treating their arthritic knee, I end up treating their insomnia, I end up treating all the other things that they have that they don't realize really are signs and symptoms of greater underlying imbalance in the body. So we have to remember that all of these symptoms that we have are really the body's way of talking to us. It's the language of the body. And we have not been trained how to listen. We've been trained to go run to our doctor and get a pill. And it's very lucrative for the pharmaceutical industry, unfortunately, which unfortunately financially backs the medical schools. So there's a little conflict of interest there. But we do need to remember that to tell our doctors that we know that This has been very studied. It's utilized in very high standing. Harvard Medical School, for instance, has a department of acupuncture. UCLA Medical School has a department of Chinese medicine. Like I said, Portland has at least 3 hospitals that are utilizing acupuncture and Chinese medicine. And at Sloan Kettering in New York City, utilizing acupuncture and Chinese medicine. So it really is very widely used. And we need to have our doctors know about it because unfortunately a lot of our doctors are new doctors. They're in the rural residency program. They're still kind of under the thumb of, no, this is our standard of care. This is what we have to do. And it's really important that their patients educate them because they haven't been practicing very long and they don't really understand that there's a whole lot more than what they learned in medical school. Okay, very good. So, as well as the gal who spoke in the video, she and Laura and especially Becca today outlined variables to wellness. And in my practice, I've found over the years that there are 4 variables, almost done, to wellness. The first one is a healthy diet. You have to be eating vibrantly healthy, nourishing foods. That means if it grew as a plant, eat it. If it got trucked out of a plant, don't eat it. And that's it, basically. And because these foods have a vibrational frequency, they're giving us something that we haven't really discovered yet in science. We don't know all these things. We know some of the nutrients, not even all of them, but we haven't looked into the string theory of plants. They have a frequency that feeds our information pathway what we need. So vital, real food is vitally important to wellness, especially if you're trying to heal yourself. If you're trying to heal yourself, at least 90% of your food needs to be vital, fresh food. The second variable is exercise. We have to move. We're created for movement. It helps our liver to function better. And when you're trying to heal from a disease, light to moderate exercise. Don't go to Zumba class and wear yourself out. You can do that if you're 25, but not if you're trying to heal from a chronic disease. So light to moderate exercise, usually 15, 20 minutes of walking every day is perfect. We need to have rest. So that means not just good sleep. It means that when your body tells you that you're tired, you need to go, you know what, I really just can't do that today. I need to rest. And this is for people who are trying to heal from disease. Don't overdo it. I have people that come to me all the time. I just push through. It's like, well, you can't do that. You have to let your body heal, basically. So love yourself and give yourself what you need. The last is attitude, positive attitude. So like so many people have said today here, you have to have a positive attitude. You have to have a good family support. You have to believe in something greater than you, whatever spiritual discipline that might be. It doesn't matter. Just that you know that you are supported, that you're not alone in the world, and you can count on something else or someone else to help you. And what we know through vibrational frequency now, through magnetic encephalograms, is that we can now measure the thought field around our head. So Christiana Northrup, MD, wrote a great book, it's fairly new, about how we change our biology and physiology through our thought process. And now we can measure the frequencies of our thought process. So when you have a thought of fear or dread or sadness or worry, your thought field is vibrating at a lower vibrational frequency, which is draining your body of vital energy. When you have feelings such as gratitude, which is one of the most important, highest vibrating frequencies on the emotional level that there is, when you hold gratitude, joy, and love as your thought process, even if you're feeling crummy, lie to yourself and say, okay, it's good, I'm good, thank you, thank you, thank you. You will be changing your vibrational frequency. So now we're out of the realm of, woo-woo, we're into the realm of science, which I love. And we know now, because I'm a why person also, this is why. Because we have now changed the information going into our neurochemistry, and it's changing us on a chemical level. So very, very important. Those 4 variables I found, when people have those in place and they come see me, the acupuncture works very fast. Just they heal quickly. When people don't have those 4 variables, they get the degree of wellness then that they came in prepared to get. So people have to do their half the homework, I do my half the work, and everyone gets better. Great, I guess I'm out of time, so thank you.
You're out of time. Thank you so much.
You're welcome.